Hi, I'm Laura, an international board-certified lactation consultant, and I'm part of the Intermountain Health Lactation team. Congratulations on the birth or soon-to-be birth of your baby. You've made the decision to breastfeed, a decision that will bring lifelong benefits to your baby as well as to you. Although breastfeeding is a normal and natural process for you and your baby, it often takes patience and practice before you're both feeling like breastfeeding pros. This video provides 10 tips to help you and your baby get off to a great start. First, enjoy regular skin-to-skin with your baby. This means undressing the baby down to just a diaper and then placing the baby tummy to tummy onto your bare chest. There's no such thing as too much skin-to-skin, so enjoy frequent opportunities to snuggle your baby. Skin-to-skin helps activate your newborn's natural feeding instincts. It elevates your prolactin levels. Prolactin is your body's milk-making hormone. It stabilizes baby's heart rate, breathing, temperature, and blood glucose levels. Skin-to-skin also promotes bonding between you and your baby, and it's typically your baby's favorite place to hang out. Feed your baby according to his or her cues, not according to the clock. You can know your baby is hungry when you see these hunger cues. Anytime you see hunger cues, it's a good time to feed your baby, regardless of when your baby last ate. Newborns usually feed well in the first 1 to 2 hours following birth, but then may become sleepy for the next 24 to 48 hours. Healthy full-term newborns have a reserve tank of fuel that they utilize during those first few days. When baby is born, your body will be producing small amounts of colostrum. A newborn's stomach capacity is only 1 to 2 teaspoons. The small amounts of colostrum are perfect for baby. As your baby removes this colostrum, frequently it helps to establish an abundant milk supply. You will receive a purple folder entitled Baby and You, Living and Learning Together. Inside the folder, you'll find this booklet, A Guide to Breastfeeding. It is a helpful resource for breastfeeding support during and after your hospital stay. In the back of this booklet, you'll find a breastfeeding log that describes what's typical for newborn feedings during the first week. Room in with your baby. We encourage you to keep your baby in your room both day and night. This will help you learn and recognize your baby's feeding cues. The evidence from available research shows that moms who keep their newborns in their hospital rooms throughout their hospital stay are more likely to effectively establish breastfeeding. Most newborns are night owls and will likely request feedings more often during the night. Try to get a nap or two in during the day to help you manage frequent nighttime feedings. A member of your care team can place a Do Not Disturb sign on your door during your hospital stay to allow you to rest uninterrupted. Learn hand expression. Hand expression promotes a good milk supply throughout your breastfeeding journey. If your baby is sleepy during a breastfeed or won't wake up to eat, you can hand express into a spoon or a medicine cup. If you're not sure how to hand express, ask your nurse or lactation consultant. Latch. Make sure that your baby is latching correctly and taking in a large portion of the breast along with the nipple. While many moms experience nipple tenderness the first couple of weeks, a correct latch will prevent nipple damage and help your baby get the most milk during a feeding. Watch for signs of effective feeding. Look, listen, and feel. Look for a deep asymmetrical latch. Listen for the baby's regular swallows throughout the feeding. You'll feel a tugging, pulling sensation, never pinching or biting or pain. Establish breastfeeding before introducing a bottle. Milk supply is fully established around 1 month. The baby latches differently on the breast as opposed to the bottle. Wait until baby has had a few weeks of practice and is breastfeeding well before introducing a bottle. Generally, it is recommended to introduce a bottle when your baby is 3 to 4 weeks old. There are exceptions. Babies who are born before 37 weeks of age or who have other medical conditions often require supplementation from a bottle while they practice and learn the necessary skills to breastfeed effectively. The preferred supplement for these babies is pasteurized human milk, often referred to as PHM. PHM is carefully processed to eliminate any potential health risks to baby. If there is a medical need to supplement your baby while in the hospital, feeding PHM will protect your baby's gut, which reduces the risk of baby developing a cow's milk protein allergy and other serious diseases such as type 1 diabetes. Watch for growth spurts. Babies go through regular growth spurts, commonly around 3 weeks, 6 weeks, 3 months, and again at 6 months. During these growth spurts, babies will want to breastfeed more frequently. Watching your baby's feeding cues and feeding whenever cues are observed will help your body increase your milk supply in response to your baby's needs. Get support. During your hospital stay, your nurse is available to help you with breastfeeding. Whether you're in labor and delivery, mom baby, or have a baby in the NICU, a member of the lactation team will visit you during your stay to answer questions and offer feeding assistance and additional support if desired. You can also request assistance from a member of our team by pressing your nurse call light and requesting a visit from lactation. We will be notified of your request and will visit you as soon as possible. Many of our Intermountain hospitals have a lactation clinic where you can schedule an appointment to see a board-certified lactation consultant. There are also lactation services offered through WIC, as well as many private practice lactation consultants in most communities. Insurance companies will typically cover lactation support services. Please contact your insurance to discover what specific benefits you have. Additional resources may be available to you. iPads loaded with videos, Living and Learning folder, Intermountain Mom's Facebook page, breastfeeding videos online, mother-to-baby medication safety questions online, and WIC breastfeeding hotline. Whether during your hospital stay or in one of our clinics, our lactation team at Intermountain Health is here to support you throughout your breastfeeding journey. We look forward to meeting you and your baby in person.